Good afternoon. My name is Dominique Ropp, and I'm a fourth year pharmacy student and the current co-chair of the Interdisciplinary Student Council.
Hi, my name is Sam Swafford, and I'm a third-year pharmacy student and the current administrative chair.
And my name is Jeremiah McGuire. I'm a second-year graduate student at the College of Allied Health and the current co-chair of the Interdisciplinary Student Council.
And today we're going to be talking about the Interdisciplinary Grand Rounds, highlighting excellence, catalyzing growth. So some background information about this idea. It was an original idea that was brought up by Sean Abbott and Daniel Jabrelli, who were the previous co-chairs of the ISC, Interdisciplinary Student Council. And they really envisioned this idea of having each college on the Health Sciences Center have an interprofessional case study of a patient that was seen at Unity Clinic. So for example, if dentistry and then College of Medicine, pharmacy, nursing, as well as PA, all of them saw one patient, they would all come in and discuss this patient's care. It would be in person, and each month it would be at a different college, which would allow everyone to kind of tour the colleges as well as learn in the same environment as their peers. However, the current ISC leadership, partly due to the COVID pandemic, as well as in an effort to promote inclusivity and broaden the appeal to those that do not face patients in their education, we really wanted to have this new vision of the Interdisciplinary Grand Rounds. We wanted a campus-wide spotlight for students to showcase their innovations, their collaborations, and their advancements of interprofessional education. So the ISC meets bi-weekly, and the executive team incorporated the Interdisciplinary Grand Rounds into the ISC. We allowed all members to brainstorm and highlight unique perspectives of their college and really establish that framework for each session that we were hoping to get. We also facilitated the content development and finalization of the Grand Rounds.
Our first Grand Rounds of the year was in September and was an introduction to the Interdisciplinary Student Council and the IEP. The second Grand Rounds was a vaccine hesitancy panel. This was to provide a toolkit to students on how to increase vaccine buy-in and how to talk to family members about vaccine hesitancy. Our third Grand Rounds occurred in November. This highlighted student-led programming and was initially hosted by the Lumina group here on campus and the Reproductive Health Symposium. Our fourth Grand Rounds of the year was in February and allowed a representative from the graduate college to highlight the great debate which occurred last week and the interprofessional education and collaboration that occurs across the graduate college. Our most recent Grand Rounds had representatives from each college speak on their personal experience within the platform of an interdisciplinary interaction. Our final Grand Rounds of the academic year will be on May 5th at 5:30 p.m., and we invite all of you to join as we explore the interdisciplinary approach to dyslexia. Our attendance numbers this year were pulled from a voluntary form released at the end of each Grand Rounds. We had over half of our attendees from the College of Medicine MD program. We can attribute this attendance survey numbers and results to credit awarded within the MD program, such as IPE hours. It also should be noted that this form was voluntary and not required for participants, so the numbers listed on our poster today and in our attendance survey chart might not totally and accurately represent the true numbers at each of our Grand Rounds this past year.
And so as we conclude today's poster presentation over the Interdisciplinary Grand Rounds, we can draw from these results that despite the seemingly insurmountable conditions that we were all affected by COVID-19, the ISC demonstrated exceptional efficacy in establishing and implementing the Interdisciplinary Grand Rounds. The implementation of the Interdisciplinary Grand Rounds succeeded in highlighting the IPE endeavors that were taking place across the Health Science Center campus, as well as enhancing awareness of these initiatives to students, faculty, and staff that may have otherwise not known about them. And as we look to the future, the interdisciplinary grand rounds will expand to collaborative partners to include each University of Oklahoma campus. This would include the Norman campus, and we did, for one of the grand rounds this past year, have a representative from social work attend, as well as the Tulsa campus, because we often have similar professional programs on that campus, and we feel that interdisciplinary education, interprofessional education are valuable opportunities for growth across all of the OU campuses. Along with that, we would like to establish consistency through fixed annual experiences. And as we currently have it slated, September would continue to be an introduction to the ISC and IP as a whole. This would allow us to catch all of the incoming students and introduce them to the Interdisciplinary Student Council's work, as well as to the IP initiatives that we have slated for that academic year. And additionally, we feel this would be an excellent opportunity to collaborate with All Professions Day. Since all incoming students are required to attend, we could incorporate the interdisciplinary grand rounds as part of that ongoing initiative. Additionally, October, we would like to maintain the vaccine hesitancy practitioner's guide and toolkit. We believe this is an important future direction for the simple fact that vaccine hesitancy has increased dramatically with COVID, and this is likely going to impact other annual vaccines, such as the flu vaccine. So really, this is an excellent tool both for talking with those who are vaccine hesitant or those who are just underinformed about vaccines, their benefits, and any associated risks that may occur. Beyond that, we would like to elicit new concepts from the broader campus community. So that falls into our incorporation of the other campuses. And we would also like to transition to a hybrid model, similar to the original vision, where a college would host the interdisciplinary grand rounds, a different event each month at a different college. And as we rotated through the colleges, again, learners would be able to experience the learning environments of their peers. And that is an opportunity that not all students currently have access to. We thank you for watching our presentation today, and we welcome any questions you might have.